Hi, I'm Associate Professor Marcus Watson. I'm the Executive Director of the Clinical Skills Development Service in Queensland. So its traditional role is the basic training role of individuals in their individual professions. The service was built to enable people to train differently, especially to train as teams and to train in the right location at the right time. So we provide a role where we're a support service and we enable the development of simulation across all of Queensland. And currently we have 65 sites that we support. We don't actually own those sites, we just support the training there by helping with curriculum, helping with support the technologies and actually training people how to use simulation effectively. So we've had many, we're involved across all disciplines, from undergraduates through to senior consultants. Some of the most major ones we had where it's not actually where we've applied it directly to teaching existing ways of doing things, it's where we've actually used simulation to examine practice in clinical areas, support practice in clinical areas and allow them to redesign their processes. So there's a really good example at the Royal Brisbane and Women's Hospital where the clinicians there use simulation to look at chest pain patient treatment, and they've reduced the time of treatment from 60 minutes down to 27 minutes by looking at all the barriers and all the training they were required to do for effective care of patients. So simulations is a technique for education, it's a technique for innovation. We need to know it's actually not reality. That there are differences between clinical practice and the simulation. And if we know those differences, we can allow for that in our training and our design. There is also large costs in simulations if we don't manage it appropriately. So for example, our service does our own technical maintenance rather than having warranties. And in that way we can repair the equipment quicker and for much cheaper costs than doing it through the manufacturers. But you can only do that on scale. And so most other sites are unable to do the types of services we do. Sure, so the first advice I give to people when they want to build a simulation centre or invest in simulation is understand what your problem is, understand what you're prepared to commit in terms of your people power and the solution, your staffing, train people, build your curricula and then look for the simulators and the facilities requirements to actually deliver that. Unfortunately, most people in healthcare work the reverse, buy the equipment and then say, how do we use it? So I see simulation being a large part of the future economy. The real world is limited by physical space. Until we get off this planet, there's a limited finite resource. The simulated world is infinite. It is what we can imagine, what we can do. We can do an experiment in simulation and try new things that we probably wouldn't want to do in the real world. We can use simulation to look at new ways to educate and first validate that before we actually test the skills on real patients. So simulation is going to totally change our world. Just like the iPhone did or the internet did, we're going to have a future generation where simulation will change it. And to put it in perspective, we've now got a generation of children that are graduating into the workforce who never knew anything before the internet. They've always been connected. My children already have avatars to help them learn at school. They're using simulation and play, far more sophisticated than in the past. And when they graduate, they will never know what it's like not to learn through simulation. In many cases, what we can do in simulation and in innovation around ICT technology, new medical equipment, we can do in days which would take years in some cases round tables to discuss. So the example of that is if you get a panel of experts together with an opinion, it's very hard to change those opinion when we find evidence that's different to it. But if we put them through a simulated experience, they can quickly change their opinion because it's their experience that's different, it's not what someone's told them. The other advantage of it is actually that experience can actually be used to redesign the actual technology itself. So it's an iterative approach that's very rapid. And in many cases we've been able to select equipment via simulation, we've been able to improve processes And we get reductions in process time between 55 and 85%. So it's a dramatic impact. So Australia, I think, punches well above its population size in simulation. We have a lot of knowledge in visualization, artificial intelligence. We have a lot of knowledge in behavioural simulation, so real face-to-face simulation. We're a trusted partner in education around the world. We're pretty good at innovating on the cheap. And even more importantly, that aligns beautifully with the Asian time zone. So our ability to deliver products in Asia, developed here in Australia, is very, very easy. And the ability to have human interaction in that simulation is much easier than, say, from America, where people would have to get up in the middle of the night to partake in the simulation. So we're pretty unique there. South Australia has an amazing history in simulation. And in fact, I did my PhD at Swinburne University in Victoria, but I actually came over here to do my research at Royal Adelaide Hospital, and even when I was doing my postdoc in Queensland, I was still returning to South Australia because of the enabling factors in simulation. You have great work in defence, great work in gaming, great work in manufacturing, great work in health that have a lot of synergy if they talk together and you start to look at it as a future industry for the state.